Hi everyone, it's Nicola here from Glasgow Live. Today I'm at Luxe Skin in Glasgow on Ingram Street, and we're here with Dr. Q, who's going to tell us all about chin fillers today. So go over and have a little look at the procedure which is being done right now. So I will warn you, if you're a little squeamish with needles, maybe peek in, peek out and have a look and see what you think is okay for you, but we're going to have a little look and see what happens during a chin filler procedure. So I suppose, Dr. Q, what are we doing today?
Right, so basically this patient, she's got a quite pronounced chin crease, and that's basically making the chin turn upwards. So what we're going to do is we're going to put sort of filler around here just to bring the chin down, and that basically gives you a sort of much more sort of younger, more youthful appearance and makes the face more sort of V-shaped.
Okay.
So I mean, sometimes with time or just sort of genetic predisposition, the chin can sort of go up the way, and that basically sort of can make you sort of appear sort of angry kind of thing.
Yeah.
So even though you're not, so basically that's what we're trying to do. The filler we're using is this one. It's the Juvederm Volux. So Volux is quite a strong filler, meaning that it's quite firm. So it's sort of ideal for things like jaw, chin sculpting. Whereas other fillers in this range are much softer, which you can use for sort of like lips and cheeks and things like that. Okay,
right.
So using a firmer filler here. It lasts quite a long time, about sort of up to 18 months.
Wow.
So there's sort of longevity with it as well. It's a reversible filler, which means you can sort of dissolve it out if you don't like the result or if there's any issues. And so we're just going to basically demonstrate what it is. So all we need to do is make a puncture here, a puncture there, and then use a blunt needle to sort of basically fill this area.
Right.
So she's already been prepped.
So she's all numb, so she's not going to feel anything now.
Well, she's not. There's two options. One is a cream, which I've used here. Other is someone doesn't like needles at all. Then you can do like a dental block. You know how the dentals your whole mouth goes numb.
Oh, right.
The only thing with that is then you just speak a bit funny for a couple hours. But that's an option, if you want. But I've chosen to go without that one because most people are fine, So here we go.
It's really exciting watching this, and it sounds really silly. It's not often that you get to see it happen live, and you maybe seen this on television or whatever before, but not actually on a real patient live on Facebook. So she's not going to feel anything just now getting these needles in her chin?
She'll feel, this is a blunt needle, so she shouldn't really feel very much. You'll feel like a bit of tugging and things, but that's usually about it. So.
Well, she's not screaming in agony, so I suppose it can't be hideously painful.
Yet.
Right, so this is basically a blunt needle or a cannula. The reason we do it with that is because it's blunt, it's not going to injure anything. And sort of the safest way of doing it rather than going straight with a sharp needle.
So how long have you been doing fillers and all the different services that you offer?
About 7 years now. In that 7 years I've done about sort of 15,000 procedures.
Wow. So obviously if someone's thinking about getting this done, go to someone reputable who knows what they're doing and been doing it for years.
Yeah, because I mean, although these are non-surgical procedures, they are still in your face really, so there are precautions you need to take, and so you need to go to someone who's sort of comfortable with facial anatomy and is able to sort of deal with any sort of issues that arise afterwards. I mean, these are sort of low risk procedures, right enough, but again, if something doesn't go to plan, you need to be able to fix it.
And you are also a medical doctor who works at A&E, so people are in safe hands if they come here.
Yep. So we're putting basically 0.5 ml on this side.
So it's really very minuscule amounts that are going in?
Yeah, so the whole syringe is basically 1 ml in total. So filler, although you sort of notice the difference straight away, it takes about 2 weeks to fully integrate with the skin and become part of it. Shafia is not very good with needles.
Oh no!
So
you're doing really well.
She's being brave today.
Can I scream? No.
Angie at home is asking what kind of the treatment's called today that you're performing.
Right, so it's basically called chin reshaping. So chin reshaping involves the chin crease here. or sort of putting filler in the chin itself. You know, if someone has like a chin sort of which is a bit recessed, you can put fillers in there to bring the chin forwards.
Right.
They say the ideal ratio is if you go from the nose to the chin, the lips should touch the finger. So Shafia is sort of perfect really, because the lips are sort of touching my finger and it's resting at the chin. If the chin is too forwards like that, then you better bring the lips out a little bit. If the chin is too recessed, then you better bring the chin out a little bit. You know, with Shafia, if you put fillers in the chin would be, you know, too out of the way, and then it won't really sort of be in proportion. So we don't need to bring her chin out. We just need to bring it sort of down a little bit. You know.
So I suppose you're always looking for a natural result when you're doing this.
So I mean, you don't want ideally with sort of fillers. You don't want anybody to sort of look like they have had work done, so to speak. You know, because sometimes people don't place the fillers correctly or have too much done, and then you get a sort of overfilled appearance.
So in case you've just joined us, we're at Luxe Skin today with Dr. Hugh, just having a look at how chin fillers work and how they're performed. So now on the other side.
Yep.
How long does something like this take from beginning to end?
I mean, the needle time itself is just about 5 minutes or so. Yeah. All in all, it would be basically a half-an-hour appointment. You know, to sort of prepare the skin, clean it.
Get it done on your lunch break.
I was about to say, and the recovery time isn't massive either, so it's not as if you're in complete agony or you can't move your mouth or anything for hours afterwards.
No. So, I mean, you can go straight back to work. There's just minimal sort of bruising or swelling. There isn't really.
So would you advise someone coming for a decent consultation first to work out?
Yeah, so we would sort of, in that one, we would firstly do like consultation to see what their issues are, what they want to achieve, and then sort of tell them, you know, how much product would be required, what the procedure would involve, and then they can get the procedure done in the same appointment if they wish, or they can come back, you know, if they wanted to think about it.
So say after it's done, if you touched your own chin, would it feel remarkably different, or would it still feel like your face? I know it's a bit of a strange question, but I've never had anything done, so it's something I would think of if I was going for something like this.
Yeah, I mean, initially you can sort of feel the filler straight away. You know, if you feel it, you know, you will feel there's something there. But within about 2 weeks, it will integrate with the skin and become part of it.
Right. Okay.
And then you shouldn't really feel it. You know.
So how much does something like this treatment cost? How much are people expecting to pay?
So basically, 1 mil of filler is $375. We're just using 1 mil here, so this would have been $375. If you use sort of 2 mils or 3 mils, then it's just accordingly, you know. For example, if you needed this to do the chin or the jaw, then you might need another 3 mils in total.
Right. Okay. So you would have a look at the person, the face, to see, okay, we'll do this bit here, this bit here, this bit here, not just okay, you've come in for your chin, let's just go straight there.
Yeah, I mean, I would sort of tell them, you know, what treatments would be suitable. Sometimes what people are looking for might not be achieved by what they think the treatment is. For example, some people may say, you know, I want this lifted, you know, can you put filler there, but that won't really work. You need to sort of put some filler around the jaw to push it back. You need some up at the cheek.
Right,
so it's best if somebody sort of says what they want to achieve, and then you can tell them, you know,
what's the procedures they're looking to have. Do you say chin fillers is maybe one of the more popular treatments that you provide?
I mean, fillers in general are sort of quite popular. Chin is quite often overlooked, to be honest.
Right,
you know, yeah. So the reason I wanted to sort of do this is to sort of bring some attention to it. Chin is people sort of always focus on lips and cheeks, cheeks, and that thing, but chin can make a big difference.
Yeah, definitely.
So, as people feel like if you put fillers in the chin, you know, it would end up like a rich chin kind of thing, to be too big kind of thing. But the chin is sort of quite important. So, and if the chin is too recessed or too sort of inverted, or then
can change the shape of the face entirely.
Yeah.
So you're saying about 2 weeks we'll be able to see a difference?
Yeah, I mean, you can see the chin has sort of come down, but it would require about another 2 weeks for it to sort of fully. I mean, she doesn't really have much sort of bruising, just a little point there and a point there, and that's about it.
And then about 2 weeks, you'll get the full result.
Yeah, 2 weeks is when you sort of get a sort of full result, because it needs to integrate with the skin, become part of it. It attracts moisture and expands a little bit, you know. So what I would say is, after a couple of days, some people go, I don't really see that much difference. We would say just wait a full 2 weeks, and then after that, if you still feel you know you could do more, then you can put more in afterwards.
Okay.
You can relax now.
You've done very well. So if you're interested in what you've seen today with Dr. Q performing this procedure, click on his Facebook page to find out more, or go onto his website, and then if you're interested in something, you can get in touch and see if it's right for you.
Well done.